So, today on Pet Talk, we're talking to Dr. Dennis Ting, a board-certified surgeon, and he's going to give us some pointers about what to do after he performs a cruciate surgery on your pet's leg. But before we do the pointers, do you want to just describe what cruciate injury is to the listeners?
Yeah, cruciate injury is very, very similar to human athlete, where the cruciate ligament is the primary stabilizer of the knee joint. And we see that a lot in dog, actually. They wear and tear, start to, weaken that ligament, and eventually become a full-blown rupture. And I can see them in a variety of stages. Like today at your hospital, I saw a patient where it's just the beginning of tear, and where sometimes I see patients where they have full-blown tear, the knee become very, very unstable. So they, certainly you see different stages of the disease. So, but it's very important to catch them and let them know what it is, so we can address them.
Okay, and so after we get a diagnosis of a cruciate ligament rupture, tear, partial or full, and depending on if surgical intervention is needing, you come on in and you do a surgical intervention, and then what's your best recommendations? What are 3 good pointers after cruciate surgery that the clients could do that will really help in recovery of their pet?
Yeah, so surgery is only just really the half of the battle, because differences in human and dog is that the dog really doesn't listen to you. If they start to feel better, all they want to do is run and jump and play and go back to their normal lifestyle. So I always tell the client that the other half of the battle is home care. So the most important thing, number 1, is exercise restriction. After surgery, the lifestyle cannot be, free roaming, unsupervised. It has to be restricted in terms of activity. So no running, no jumping, no playing. So that's probably very, very important, number 1. Number 2, the first couple of weeks or so, the first 2 weeks until the stitches come out, make sure they do not bother the incision. That's probably the most common phone call that I get after surgery, is my dog chewed the stitches out, or so on and so forth. And sometimes they only take the e-collar off for 2 seconds, and then the dog turn around and take the stitches out. Most of the time it's not a problem, but certainly that's one thing that I hear a lot. So that's number 2. Number 3 is very, very important. Again, you have to have appropriate level of activity. We said earlier we don't want too much activity, but the third thing is you want to have appropriate level of activity. You don't want them to just sit there and do nothing. You want to move them. You want to get them off that floor and start moving them, walk them, a couple times a day, 10 minutes each time or so. Stretch that leg and massage and warm compress, a little bit of a PT to begin with, and then gradually ramp up a little bit.
And when you say PT, you mean physiotherapy for the
physiotherapy? Yes, correct, yeah.
And they're actually for our viewing audience they're actually physiotherapy centers that actually do full-blown physiotherapy, just like you get in the human world.
Right, they're full physical therapy center, and there's actually a lot spring up everywhere. But this is the thing gotta be really important, is that you can go to physical therapy, but you have to make sure they do it every day. So that means that you probably go to the physical therapy once a week for 6 weeks or so, like that. However, that's not enough. If you just do that, then you're never gonna get better. It's the daily activity, daily PT, that's what really counts. So
okay, great. Okay, thanks for those pointers, Dr. Ting.
Yeah, no problem.